I'd like to tell you a short story about a very meaningful moment in my professional career, and this involved Dina, the nurse. She and I went out to do a pre-admission assessment for a client who was living in an assisted living facility, private pay, that was in the area in which our skilled nursing facility was. And we were told by the staff and the family of that facility that this client couldn't do anything anymore. In fact, this person had stopped eating, had stopped participating in activity. She was always lethargic, fatigued, and she was put on hospice. She was deemed as someone who was dying, actively in the dying process. So Dina and I went out, Dina with her medical knowledge and some Allen understanding, and me with my OT and Allen expertise. And the first thing that we did is we put on that pair of glasses of looking at her from what can she still do and what can we facilitate. So we got done reading the report. We were told that this lady used to be a secretary, so we walked her over, or actually wheeled her over in her wheelchair to this area in which they had an old typewriter. So we set her in front of it and I started hitting the keys. And all of a sudden, you saw this lady who was sort of hunched over in her chair, her eyes open, and she sat up and she started looking. She started engaging. So I hit the keys a little bit more, and then I put her fingers on the keys, and before you knew it, this lady who we found sleeping in the wheelchair was actively engaged in this activity of hitting the keys, and she actually started to try typing her name. We then were able to get her up out of the chair. She took a few steps. I brought her into the bathroom. I saw that she had the ability to hold and use ADL objects like a brush and a toothbrush. This was not somebody to us that seemed at end of life. And this was a woman who appeared before our eyes to be awakening. We brought her to her community upon the blessing of her daughter. She moved out of the other facility and came to ours after we told the daughter what abilities we had discovered and what we thought life might be like for her mom. And within a week, this resident was off of hospice. Dina had discovered that because this lady had so many behavior issues in the past that they over-medicated her. So Dina put her with the physician's agreement, of course, on what's called a drug holiday. So when these medications sort of were stripped away that were masking her abilities and causing her to be so lethargic, we literally saw an awakening. We also found out what she liked to eat. We coached and cued her so that she was able to feed herself. And research shows when we feed ourselves, we swallow more safely and we eat better. The therapy team brought her down to the therapy clinic, and they knew from her daughter's description that she loved gambling, and we happened to have a slot machine down there. So they put the walker a few feet from the slot machine, and they asked her to stand up, and up she went. She walked over that slot machine, and of course, every time they moved the wheelchair a little further back, so she increased her distance. But what happened was, by understanding her Allen level, this was our goal. We knew what we could shoot for. We saw abilities instead of deficits. We started peeling away the layers, the over-medication. We started peeling away the layer, the shroud of negativism that had been put on her by the other facility. And eventually, this lady started to herself feel as if she had a will to live. I am now talking about a story that happened 2.5 years ago. This lady is still living, and living a quality life. Her daughter made the right choice by entrusting her mom to us. There are many clinicians and facilities out there who have good heart, but caring isn't enough. You also have to have the skill to be able to understand the abilities, to be able to identify the abilities that lie within somebody at these advanced stages of dementia. And this is a way in which we then can make significant change and improvements. That was just a wonderful story.